If you've been on TikTok recently, or really any social media platform, then you've probably heard a lot about ADHD. But what is it really, and how do we treat it? So ADHD is a neuropsychiatric condition that we see in both children and adults. And while it's commonly associated with being a childhood disorder, many people still experience symptoms well into adulthood. There are two important chemicals involved in ADHD: dopamine and norepinephrine. Dopamine plays a major role in our motivation, attention regulation, pleasure, and reward processing. Norepinephrine helps to regulate alertness and attention, acting kind of like the brain's highlighter by making certain information stand out while reducing distractions. Signaling of these neurotransmitters is often less efficient in people with ADHD. Imagine being assigned a simple task like starting a homework assignment. For someone without ADHD, dopamine release helps the brain recognize the task as important and rewarding, making it easier to begin and stay focused. For someone with ADHD, that dopamine signal is weaker or less consistent. Even though they understand the task is important, their brain doesn't register the same sense of urgency or reward. This leads to procrastination, distraction, difficulty starting the task, or skipping it altogether. This is often mistaken for laziness or lack of discipline, but it is neither of those things. It is brain chemistry. By increasing dopamine availability with medications like Vyvanse, those signals can be strengthened. Vyvanse is unique because it is a prodrug, meaning it is inactive when taken. It isn't active until metabolized by the body. Enzymatic activation works by enzymes in the bloodstream removing part of the molecule to create dextroamphetamine, the active drug. Because Vyvanse must be enzymatically activated, it has a slower onset and the same exposure whether taken orally or intranasally. This is important because people with ADHD have a higher risk of substance abuse, and slower onset drugs have a lower drug liking. Once activated, dextroamphetamine increases levels of dopamine and norepinephrine in the brain by promoting their release and slowing their reuptake. Reuptake is the process where neurotransmitters are recycled back into the neuron after sending a signal. This leads to improved attention, focus, and impulse control in individuals with ADHD. By understanding how medications like lisdexamfetamine work at the chemical level, we can better understand that ADHD is not a lack of effort, but a difference in neurochemistry.